Here are the three most common conditions that I see within the clinic. Number one, it's migraines. Migraines, what's happened is that there's a dysfunction inside of the central nervous system where the brain is unable to effectively communicate with the body and the body is unable to communicate with the brain through this thing called subluxation, or what I like to tell my patients is an upper neck misalignment. How can this happen? Thoughts, traumas, and toxins, or physical stress, chemical stress, and emotional stress. When these three stressors are placed onto the system for prolonged periods of time, what it does is it causes complications on the body. What's going to happen is eventually that blender is going to break down. Our body's the same way. So the number one thing that I see in the clinic is migraines because of this reason, because these physical, chemical, and emotional stressors have wreaked havoc on the nervous system. And by doing that, it causes the body to send off a sympathetic response into the head of what's known as a migraine. Number two, autoimmune conditions. An autoimmune condition is what? It's that the body is finding that there's foreign invaders inside of it, so it's sending a stress response to be able to attack itself. But if our bodies were designed to heal, why would the body ever want to attack itself? Because of stress. Physical, chemical, and emotional stress. This is also why these three things, physical, chemical, and emotional stressors, elicit a hyper response, or what's known as a flare-up inside of people with autoimmune conditions. Number three, anxiety and depression. Now, in no way, shape, or form am I a therapist, but what we see is that when someone is dealing with anxiety or depression, they have a hypersympathetic response. And because of this hypersympathetic response, their body sees things as a constant fight or flight. And so by taking care of their nervous system, what we're able to do is we're able to down-regulate their nervous system and allow them to be able to perceive life as it's happening and not what potentially can happen.